Thank you. So first, I would like to thank Extraw for the invitation to speak as a part of this webinar series on their behalf. I am employed by Labcorp Drug Development, and we use Extraw products to advance drug discovery efforts. And I'm going to be talking a little bit about that today, specifically using our GL261 orthotopic murine glioma model. So oncology, is one of those fields that radiation has been, a mainstay for a number of years. The American Cancer Society predicts 1.9 million new cases of cancer diagnosed this year. More than 50% of those will receive radiation therapy as part of their treatment plan. There's been a lot of advances in the field of radiotherapy over the years, mostly due to improved imaging techniques and also improved treatment and delivery plans. But despite that, despite the advances in radiotherapy, there continues to be very little progress in terms of development of drugs to be used concurrently with radiation, which is kind of surprising if you think about it, given how popular radiation is in this field. And that can be due to a number of reasons. One may be just a lack of regulatory precedent on the simplest end. But I think in addition to how little combination strategies with radiation are used in the clinic, that's also seen preclinically, that there's a large opportunity to use focal radiation therapy in the context of early drug development, but it's not really used all of that much. And we're trying to change that. So Labcorp has been working with Extraw for a number of years to use their SARP system. SARP stands for Small Animal Radiation Research Platform. And what this machine is it delivers focal radiation to a specific site in the animal. For us, it's going to be either a subcutaneous or orthotopic tumor model. And you can see that the clinical radiotherapy and the preclinical radiotherapy type of delivery system is quite similar. They both use the CT guided imaging as far as locating the target, individual treatment plan for, in our case, each mouse, as well as treatment delivery are very similar between the two. And so we've been using this for, again, for a number of years with our Syngeneic tumor models, which have mice with an intact immune system. So radiation is known to modify the tumor microenvironment, also to synergize with immune modulatory agents. And given how popular IO and IO-related research is right now, we really want to take advantage of using focal radiation in a number of, in addition to a number of the other tools in our toolbox to help advance drug development. And what I'm showing here is just a few of the profile work that we've done with our syngeneic models. And one thing you can see right off the bat is there's quite a varied type of responses to radiation that you see here. For example, the E0771, which one of our breast lines, is quite refractory to treatment, whereas HEPA-16, one of our liver lines, is quite sensitive. And we use these data to help our clients, to help inform our clients for the most appropriate model to use based on the goals that they're trying to achieve in their preclinical study plan. So what I'm going to be talking about today is our GL261 orthotopic glioma model. This is a model that's implanted directly into the brain of mice and is monitored by bioluminescent imaging using one of our IVUS imagers. And so this is a setup of how this study was run. First, we implant the tumor cells directly into the cranium of these mice stereotactically, and then let the tumors become established over the following week. On day 6, we will, on day 6, we enroll the animals based on their initial BLI signal, and then treated them with either focal radiation, anti-PD-1, or a combination of both. And we ran 2 studies using a similar design, one to look at the efficacy of these treatments against the GL261 tumor, and also a second study to look specifically at immunomodulation in the brain on day 12 and day 20, which effectively is after 1 week and 2 weeks of treatment. So one thing to notice right away with this focal radiation platform, and I mentioned earlier, is this individual treatment plan. So what you can see here is a focus on the cranium as well as the entire animal, but you can see that the isocenter, the beam isocenter is directed towards the tumor itself, so you can avoid any potential off-target toxicity such as oral mucositis. So this is the efficacy data that was generated as part of the first study. You can see that the untreated tumors were progressed very rapidly. Most of the animals were off study by about 20 days post-implant, and that's pretty normal for what we see out of this model. Now adding anti-PD-1 to the mix, you see maybe some animals that responded a bit better. You have one animal that responded very well, but for the most part, there wasn't much modulation going on as far as efficacy is considered. Now, looking at treatment with radiation, you can see a very nice delay in the tumor progression here, as well as a couple of animals in this group that responded quite well just to radiation alone. Now, when you add anti-PD-1 to radiation, you see a very strong response in all but one animal. And these mice at the end of the study were, they had durable complete responses. And so that shows to us some synergy between the radiation and radiation plus checkpoint blockade. And you can see on the right-hand side, just the BLI images showing the differences in the signal between the groups. So we wanted to look beyond efficacy and more into the tumor microenvironment to see how radiation could be contributing to what we're seeing here in the overall efficacy of this combination treatment. And so we looked at, again, after 1 week of treatment on day 12, 2 weeks of treatment on day 20, looked at both the myeloid and the lymphoid compartment. The lymphoid compartment is shown here, specifically showing data with CD4 helper cells, CD8 cells, as well as immunosuppressive regulatory T cells. And so what you can see is across the board on day 12, there's not much modulation going on. This is fairly normal for us. It usually, with radiation studies, will take about a week or so before we start to see a real difference in activity. And that's really shown here on day 20. You can start to see some really nice immunomodulation going on inside of these brains. So you can see with radiation and with the radiation combination, a really nice increase in the percent of CD4 positive T cells. Although there's only some slight, perhaps some slight increases in the CD8 infiltrate, but the other important thing to note here is the drastic decrease that we see of these immunosuppressive regulatory T cells, particularly in this combination group here. And that just indicates that these regulatory T cells are being cleared from the tumor, allowing these the cytotoxic T cells to exert their effect on the tumor. So now looking at the myeloid compartment, both the granulocytic and monocytic MDSCs, you can see again on day 20, the infiltrate is fairly stable between these two. On day 20, it continues to be stable with the granulocytic MDSCs. However, with the monocytic MDSCs on day 20, you begin again to see this nice decrease of these immunosuppressive cells in the context of treatment with radiation and the radiation combination. And then to expand on the myeloid compartment, we also looked at M1 and M2 macrophages, and again show a very similar trend. Day 12 for both M1 and M2, maybe some slight modulation, but nothing that is really of note. However, on day 20 is where you begin to see some differences. So on day 20, we do see a slight decrease with anti-PD-1 as well as in the combination with the M2 macrophages, or with the M1 macrophages, sorry. And then on day 20, you begin to see a really nice clearance of the M2 macrophages, particularly in this combination group here, but really in all of the treatment groups combined. And so what this again shows is further support for the idea that these immunosuppressive cells are potentially moving out or moving away from the tumor, allowing for a mounting immune response and activity of these cytotoxic T cells. So in conclusion, radiotherapy is a highly utilized clinical treatment modality. There is a lot of opportunity to look at radiation in combination with other drugs in development. But we do see a lack of progress both clinically and preclinically, despite the importance of the potential use of radiation in combination with some of these drugs. And so we've been using the SARP system along with the help of Extral to provide a powerful tool to look at radiation combination strategies in the preclinical space. And this is particularly around in vivo tumor models, both syngeneic tumor models, as well as human xenografts using nudes and skin mice. Now focusing on the GL261 data that was presented. GL261 is responsive to focal radiation delivered by SARP. This efficacy is enhanced by the addition of anti-PD-1 therapy. And we also saw modulation of both lymphoid and myeloid subsets, particularly increases in CD4 helper T cells, decreases in immunosuppressive T regulatory cells, as well as the monocytic M-MDSCs and the M2 macrophages. And so this preclinical application of SARP, in addition to helping with model selection, can also help inform rational combination strategies and mechanistic insight for translation to the clinic through these studies that look at efficacy and changes in the tumor microenvironment. So just wanted to thank those that were involved with this project. Marilyn Franklin and Scott Wise were big proponents of bringing the SARP system in a number of years ago and getting it set up and ready for use. And then the group of Labcorp folks here are the folks that were involved with designing these studies and executing these studies. So with that, I appreciate your time and look forward to answering any questions.